everybody. Ugh. Okay, we'll get set up here. All right, hi everyone. Welcome, welcome. So today we are going to be talking about heartworms primarily. It's our third Facebook Live, so we're getting a little bit better. I'm getting a little bit more punctual. So I'm pretty excited to keep hosting these every month. We try to focus a little bit on things we see, time of year, stuff like that. So today, again, we're going to focus on heartworm disease and kind of see how that gets going here. So throughout the event, we encourage you to submit questions as usual. We do answer a lot of questions. We like a lot of Q&A in it. Kind of keeps it flowing and is able to help us focus in on the things that you guys really want to know about it. If there's an area that you find confusing or anything, we are going to feature our heartworm preventatives on our online store. We do have an online store, so as long as you're a patient here, you should be able to get on there and find those. You can just go to our website, geraldsonanimal.com, click on the Pet Pharmacy tab. It'll take you right there. And like I said, we're going to start featuring the heartworm preventatives and things that are available there, since that's what we're focusing on here. And then, well, we'll get rolling. Okay, so first question I get a lot is, what are heartworms? So heartworms get confused a lot with worms in general or gastrointestinal parasites. The big difference between heartworms and gastrointestinal worms, or worms that live in your GI tract, is that heartworms actually live in the bloodstream. So they don't pick them up from eating dead things, okay, or anything like that. And the dewormers that you can purchase from TSC and Walmart and all the over-the-counter places, they don't touch it at all because it's not in the GI tract at all. It's in the bloodstream. So one of the great resources to really kind of delve into heartworms is the American Heartworm Society. And I stole a diagram off of their website here. Okay, so I'm going to try to hold this up to the camera really well. All right, so this is kind of a neat diagram. Let me try to get it centered there. Maybe. There we go. So you can see the dog at the top. Okay, this dog, we're going to say some kind of canid has a current heartworm infection, so then a mosquito is going to bite it. And this mosquito is essential for the life cycle of a heartworm. Then he's going to go down, and inside the mosquito, it usually sets up in its salivary gland. That larva that it picked up from the bloodstream of that infected dog is going to mature. Okay, then that mosquito, with its maturing larva that it picked up, is going to bite either a dog or a cat. Then that is going to sit underneath the skin there for a while in the tissues of the dog, and it's going to develop. Then it's going to move into the bloodstream, and it's going to set up shop between the heart and the lungs in the major blood vessel there, the major cardiopulmonary blood vessels. There it's going to grow into an adult worm, and then it's going to start producing its own eggs or microfilaria out there that's going to go into the bloodstream, and that's when another mosquito can bite the dog and pick up that form of the heartworm and start the process all over again. So it's this little cycle, okay? The big difference between dogs and cats is cats are usually an unintended host, okay? So dog heartworm infections, they can get a lot of adult heartworms built up in them. And they're the ones that when the mosquito bites, it really continues the process, okay? So it really infects that mosquito. When cats get it, they usually get just a couple adults, if that, and they don't really produce that much microfilaria. So a lot of times if a mosquito bit an infected cat, it wouldn't necessarily pick those up and then pass it on. But the cats can still get really sick from it. And we do see heartworms in cats. It's harder to test for heartworms in cats, so it's not talked about as often as dogs. And as I mentioned, the infections themselves are usually a lower number of worms than the dogs, but we do still see it. One of the nice things that I want you to look at is I want you to focus on that blue line here on this little graph. That is the larval stage, okay? That stage is the stage where, if we look here, this is from the American Heartworm Society as well. that blue stage there, that larval stage, it coincides perfectly with that little circle. I'm crooked. There we go. That is the only stage that our preventatives are effective at killing heartworms. So that's why they are definitely preventatives, because they don't touch the adults at all. They also don't affect anything in the mosquito at all. So once that worm develops past that larval stage in the tissue, past that effective stage where the preventatives can work, they're not going to do anything. And you need to use a different drug to treat the heartworms and get rid of them. So that's where we get into heartworm testing and why heartworm testing is required before going on a preventative. And the big reason is if we have adults already in the system and we go on a preventative, it's not going to do anything to help you help your pet. And your pet can still die of heartworm disease even while on a preventative. Okay, so where are heartworms? Okay, is that just a southern thing? I get that a lot. Heartworms are more prevalent in the south where there's more mosquitoes, but every single state in the United States has heartworms. And it's not just our domestic dogs and cats that get it. It is oftentimes the wild canids. So your coyotes, your foxes, all of them, they do die of heartworm disease as well. In fact, they use a lot of trap and release for coyotes and things like that to try to estimate how well we're controlling it. Obviously, they are not going to get on any heartworm preventative, but you can use them as a sentinel to see how well are we doing in keeping our dogs and everything protected and keeping all of that going. All right, so first question that came through is, what are the long-term effects of heartworm in dogs and cats? So long-term effects of heartworms usually coincides with what you see with heart failure or heart disease. So you'll get congestion in the lungs. The heart a lot of times will not be able to pump as effectively as it can otherwise. So you're going to basically see the signs of a congestive heart failure. Your pet will have a cough. It'll have exercise intolerance. It'll build fluid up in its lungs. And that heart will continue to try to pump as best it can, but not really be able to because those worms are in the way. They're basically, think of the worms as they grow as like a blood clot. That's basically what they're doing, and it partially blocks that blood flow. And then as you get more and more and more and more worms, it blocks more and more and more of that vessel. So to compensate, the body is going to try to push the blood faster and through it, which wears the heart out faster. It also damages that vessel right there because it's trying to block it completely, and so that vessel a lot of times will dilate, trying to give it more space to get around the worms. So you end up with the signs of congestive heart failure due to the heart's inability to effectively pump its blood. You can also get sudden heart attack and things like that if the worms get to the point where they actually cause a blockage. Okay, so kind of the same thing there. Other things a little different from just congestive heart failure that you can see with this is the adult worms, they do have a life cycle to them. And when they die, a lot of times the antigens on their surface, the pets can have an allergic response to, an anaphylactic response to. And so your pet can get into a sudden acute respiratory distress anaphylactic reaction to the death of one of these adult worms and die rather suddenly. So if you didn't pick up on the more subtle signs of exercise intolerance, cough, moisture, things like that, your pet could, die rather suddenly, and it would be because one of these adult worms died and you had an anaphylactic reaction. Now, anaphylactic reactions to adult worms dying is more common in cats than it is in dogs. And I think that's because they're not designed to be a host for for heartworms. They're kind of a mistake, so to speak. The heartworms didn't intend to infect the cat, but they did. All right, do dogs and cats really need heartworm pills? So Need is a question of risk. So anytime you don't put them on preventatives for things like this, you're essentially playing the lottery, and it all comes down to odds. Okay, so it's not a game that I would want to play. I think that it is definitely here. We do see heartworm infections in pets here in Carrollton. We usually see about 2 or 3 a year that are heartworm positive, which means it is in our mosquito population for sure. Down south, they have a much higher percentage, so your odds of getting it are a lot worse down there. So if you're on vacation with your pet or head further south, then you definitely want to kit them on something. So the question of need is more a question of risk, and I think that the risk is high enough that I would definitely put all of my pets on the preventative for sure. We have lots of options for preventatives. So if your pet doesn't like the monthly chew, that's okay. They've actually come out with an injectable heartworm preventative that we can give them. Unfortunately, it is only for dogs. It's not for cats, but it's called ProHeart. It's made by Zoetis, if you want to look it up. It works very well to prevent heartworm disease, and the injection can either be given every 6 months or every 12 months, depending on what the clinic carries. We carry the 12-month prevention. We find it's really convenient. It works great. The pets we've used it on are doing wonderfully on it. So that would be for our pets who don't like the chews, go for the injectable. It works great. The advantage or the difference, okay, with the injectable is the convenience factor. Okay, your dog's covered. You're not going to have that lapse in coverage. Everything's going to be good. Versus the chews, what is there to that? Well, the chews, if your dog really hates shots, the chews are definitely an advantage. They like giving treats every month. The other thing is the chews get other worms too. So with the chews, they made them more broad spectrum. They're going to get heartworms and they're going to get some other things as well. But for today, not to get distracted by too many parasites, because there's lots of parasites we could talk about, we'll kind of focus back in on the heartworms and say that you have those two options for heartworm preventative itself. Whether we would recommend that you definitely go with the shot versus the pills is going to depend on your individual dog and their exposure to everything, how they handle shots, how they handle chews, all of that. Okay, so like I said, we could talk for an hour on almost all of these different preventatives and everything. So we'll kind of stay focused, or at least I'll do my best. So as far as the other thing that gets asked to me a lot with this is the testing requirement. So, okay, you need to test my dog, or okay, you need to, before I can get on this preventative, because the preventative's not going to do anything to the adult. But at the same time, the preventative's not going to do anything to the adult. Why can't I do the slow kill method? I get that question a lot. The slow kill method was a method that came out when imidacide, which is the drug we use to kill adult heartworms, was no longer available in the US. It went through a phase where you can only get it overseas, and I'm not sure why. Honestly, I haven't looked into it very much, but I do know that there was a time when imidacide was completely unavailable, so our hands were kind of tied. We had no drug that could legally kill the adult heartworms. So the slow kill method came about. It was basically you get your dog on the preventative, you keep them from getting more adult heartworms by killing that macrofilarial stage in the life cycle, and eventually you just kind of wait for the adults to die. It sounds great. It sounds simple. It sounds perfect. What are the dangers with that? Well, the dangers with that is that you are going to have those adults die, and as I mentioned before, you can get that anaphylactic reaction to the proteins on the surface of the adult, which can send your dog into a crisis. Okay, they're going to, same as with people, they're going to essentially go through a heart attack. They can't breathe, or they bronchospasm, all of that. So a severe allergic reaction to these surface proteins. The other disadvantage of that, and this is one that we found with time, is that when you give these preventatives with the adults in there, you essentially build up resistance in these adults and in their offspring to our heartworm preventatives. And we're really finding this as a major problem down south, where the slow kill method was used the most because they have the biggest problem with heartworms there. So when imiticide wasn't available, what do? Let's do this. And now we're seeing all these problems, is that our heartworm preventatives are not as effective as they used to be. We don't really see that problem here in Ohio, but it is a national problem, and pets do travel everywhere. So we really need to keep this in mind, that building that resistance to our preventatives puts everybody at risk, even if the only dogs that are currently truly suffering from this on a daily basis are the ones down south. And what you'll see in these pets is even the pets that are given that monthly preventative every month, on time, all the time, they get a heartworm infection. And it's because it was one of these resistant microfilarias that came into the bloodstream from the mosquito bite. And we think that those are a result from trying the slow kill method when imiticide wasn't available. So that's why we really want to test, even if they are on a preventative, to make sure that our preventatives are still working, because we've seen this problem in the heartworms themselves. And we also really want to test before we get them on it, because if there are adults, we need to kill them, okay? And we need to kill them with some imiticide. The active drug in imiticide is melarsoline, okay? It's a pretty nasty drug, okay? So that's another reason why we push preventatives all the time. When you go on these, the adult worms are hard to kill. You have to weaken them with a course of antibiotics. Then you have to go and give them the melarsoline. At the same time, you need to put them on steroids in case you get that anaphylactic reaction, and we need to keep them for monitoring. And sometimes you have to repeat that depending on how bad your infection is or how compromised the dog is. And you need to be very exercise restricted throughout the entire thing, because you don't want to stress that, because you got a lot of inflammation going on in the body, and you don't want to get to the point where the pet goes into a crisis. Okay, so there's a lot that goes into treating adult heartworms. It's not simple, it's not easy, and it's not without risks. What's way easier and way more simple and way more safe is to just keep them on that preventative and not get that adult infestation to begin with. The next best thing is to test them and get that treated right away before there's any clinical signs. And because we're seeing this breakthrough, particularly in the southern states with our preventatives, that's why even if you're on a preventative, your veterinarian is going to require testing to make sure it works, to make sure that if worst case scenario, you got that unlucky mosquito that bit and your preventatives didn't work on that microfilaria, you can treat that adult infection before it becomes a big problem and before your dog is at a high risk of dying. Okay? So, and like I said, I know I saw a question coming through here, so let me grab that. Maybe not. My phone keeps beeping at me. There you go. When should my dog or cat be tested? Okay, so when should your dog or cat be tested? Well, going back to this complicated life cycle, and this is where a lot of confusion comes around with heartworms because of this complicated life cycle, right? Okay, so if you look at this, and you can, again, go on the American Heartworm Society, you're going to see here, it takes about 6 to 7 months in a dog after they get bit by that mosquito and get that filaria in there in order for that to get to the adult stage that's reproducing offspring and making the microfilaria. And my tests check for that microfilaria. In cats, it takes about 7 to 8 months. Okay, so it takes a little longer to develop in cats than it does in dogs. So why do we just start puppies on heartworm preventative without testing? That's why. Because even if they got bit the day they were born, it would still take at least 6 months before they would show up positive on any of my tests. So that's why we just start them up on the preventative, and then we want to test them once they get over 6 months of age. A lot of times we'll time that up with their 1-year boosters, because you're having a visit to us anyway, and then we can check and make sure that we got them on preventatives before anything slipped through. Okay? And then as far as cats go, unfortunately, there's not a really good test for cats. And the cats, a lot of times with preventatives like this, kind of get the short change or the short end of the stick, just because there's not as much money in cats. And I hate to say it, but that's the way it is. And all of our drug companies, They care about the bottom line. If they don't think they can make money putting all this stuff into research and testing in something in cats, they're not going to do it. And heartworm is primarily a dog problem, and a lot of people aren't worried about it in cats. So as far as cats go, we don't test cats. We just try to get them on preventative. And if we think highly suspicious of a cat heartworm infestation, we're going to do a blood test, and we got to send that off to a lab and tell them specifically to look for heartworms in cats. And it's tricky and it takes a lot of time, but they don't have the little point of care tests for cats like they do in dogs. So do we see some heartworm disease in cats? Yes, but usually we're going to catch less of it because we only send it off if there's a high suspicion of heartworm disease in that particular animal. There is a preventative for cats for heartworms. It's called Revolution Plus. It is, as far as I'm aware, the only practical heartworm preventative for cats. It's topical. It also includes fleas and ticks in it. There is a chewable, at least there used to be, like a HeartGuard chew for cats. It wasn't really popular. I'm not sure if they make it anymore. That kind of takes us back to drug companies don't put as many products out there for cats because not as many people buy them, and so they can't make money at it. So I'm not sure if the HeartGuard for cats is still available. Most people don't like pilling their cats, but I do know that the Revolution Plus is a heartworm preventative for them as well, and the company is able to kind of get away with that, I guess, because they include it with the fleas and ticks, which you want to be on anyway. And that's a parasite people can see, so they're willing to spend money on that. Couple other questions. Is heartworm disease contagious? How is it transmitted from one pet to another? So it's contagious in the sense that if you have a large population of heartworm positive animals, they're more likely to infect other animals. But it has to go through that intermediary host. It has to go through a mosquito. It has to mature in the salivary gland of the mosquito. Otherwise, it's not going to infect the other animal. So it cannot go, like if I have a heartworm positive dog in my house, I don't have to worry about keeping him separate from any of my other dogs because he's not going to be able to pass that contact to contact, direct contact. He have to go outside, get bit by a mosquito, infect that mosquito, and then wait about 2 weeks, and then have that same mosquito bite one of my other dogs in my house in order for that dog specifically to have given it to my other dog. So the chances of that are really low. Now, if you do have a heartworm positive dog in your house, that means that the mosquitoes flying around your house carry heartworm. So it's more likely that one of your other dogs will show up heartworm positive because they live in the same area. But the chances of your one dog in your house directly giving it to your other dog, very low. It's probably more you live in an area that has a high population of the mosquito population carrying around heartworm. That's more likely how it's going to happen, as opposed to direct contact or anything like that. So that's kind of, it's a complicated life cycle. We keep coming back to that, and I keep hitting on that, but that's where a lot of the confusion comes into play, is it's not a simple, straightforward, okay, I just give them this and I can kill it. We can only kill it during one phase with our preventatives. It has to go through a mosquito. It has to sit under the tissue. It has to migrate into the bloodstream. It has to set up shop. It has to mature, so there's this patent period, and then it has to produce more microfilaria before I can find an adult. Okay, so you would have a heartworm infection for usually 6 to 7 months before I'm going to be able to find it. So then you go into, all right, you found it right away. What kind of damage is there? Is that reversible? Unfortunately, it's not reversible, and there is damage. So we've found from necropsying other pets that even if we're just catching our heartworm infections on routine screening checks, no clinical signs, no nothing like that, how much damage did that do? And they're finding that there's permanent damage in the blood vessels from that heartworm attaching and causing it to dilate. And you'll notice usually a dilation of the chamber of the heart that is right next to that blood vessel because it's working harder. It's trying to move more blood than it normally would. And those changes a lot of times are permanent. You're going to permanently have scar tissue there. You're going to permanently have a widening of the heart there. And so a lot of times pets that show up heartworm positive get successfully treated for their heartworms, and we count it as a successful treatment if we rid the pet of an active adult heartworm infestation. They will have potentially lifelong complications or problems with their heart, and so they'll have early heart disease that you just have to manage. So it goes from being something I can just cure to now something we're going to manage lifelong for the pet. And the earlier you find it, the less that you're going to have that long-term things that you're going to notice clinically that you need to manage. So that's another reason why we test all the time for it. So as far as fully recovering from heartworms, they can fully recover in the sense that if we've caught it early enough, you won't notice long-term damage from it. But if we catch it later, usually there's a lot of stuff that goes on. Okay, so it looks like that was kind of our last question. Okay, the last question was, can they fully recover? Yes, with some asterisks. Okay, so they can fully recover in the sense that we rid them of the infection and we stop the damage from getting worse, but we cannot reverse the damage that was done. And that's probably the saddest, hardest thing when it comes to heartworms. And hopefully that's kind of explained why we want to test them so often. It's because it's a complicated life cycle and we want to make sure we're treating it at the time that's going to be effective. And we also want to keep testing all the time because we don't want them to get to the point where they have that permanent damage, where you're trying to cure this dog of a heartworm infection while balancing the risks of the dog dying from the cure. Okay, so there's a lot that kind of goes into that. So first, to kind of wrap it up a little bit, what I do want to just kind of say thanks to everybody. I want to take this opportunity to just say thanks to everybody for working really hard, trying to get all this stuff going here. It's hard to do, and we know that our clients and everyone, it's hard to get them in here, get them protected, and keep everything rolling the way it needs to roll. I also wanted to mention too, you know, Dr. Klein and Dr. Gardner, they're talking to all of our clients and everything about this as well. And they're just as knowledgeable. So if you have any questions, it doesn't really matter which one of us you talk to. They're going to be able to help you out just as well. Can talk to you about all the options, recommend specific things for your pet. So as I mentioned, we are going to feature our heartworm preventatives on our online store. And then next month, we're going to talk, kind of keeping with the parasite theme, just a little bit different. We're going to try to focus on fleas and ticks, and then other bugs that they can get. So we'll also talk about the gastrointestinal worms. We're going to talk about how they pick up these things, where do they come from. We're also going to take a little bit to focus in on Lyme disease. We're seeing a lot of Lyme disease here in Carroll County, so we'll use that opportunity to talk about that, as well as the other parasites and things. So kind of tie back into today, because we talked about, briefly mentioned that our one heartworm preventative also gets some other things. That's the chew. So we'll talk about those other things as well. We do have a blog, so you can follow us there. We also have Facebook, Instagram. We have some YouTube pages that we're working on. We've recently gotten a TikTok channel. We're trying to post some cute stuff there. So those things are always fun. Just kind of keep an eye out on those. We do like to try to have fun here. We get a lot of great pets, a lot of great clients, and we just want to share those with you too. So if you have any questions, again, that you can think of, you want us to focus on, please send them to us ahead of time. We love doing that. Helps us kind of focus and get everything that you want to know answered. So again, thank you for coming. I really appreciate it. And give us a call anytime. Bye.